Arrogance in a trauma bay is a lethal contagion, and Dr. Mason Alpert was patient zero when he sneered, "You're just a nurse," at the woman who had just corrected his fatal error. He had no idea he was insulting a decorated war hero or that a 4-star general was about to walk through the doors to settle the score. St. Jude's Memorial Hospital in downtown Chicago was a meat grinder. As a level 1 trauma center, it was the final destination for the city's worst nightmares: shattered bodies, broken lives, and the desperate, bloody fight to keep souls tethered to the earth. The air always smelled faintly of iodine, bleach, and the metallic tang of fresh blood. It was an environment that broke the weak and hardened the strong. Isabella Jenkins was undeniably the latter. At 42, Isabella was the veteran charge nurse of the ER night shift. She wasn't the type to command a room with a booming voice or a flashy personality. She was quiet, deliberate, and possessed a terrifyingly calm demeanor that unnerved the younger staff. While the residents panicked over crashing vitals, Isabella moved with the terrifying precision of someone who had seen much, much worse. She kept her graying blonde hair pulled back in a tight, no-nonsense bun, her scrubs immaculate, even 12 hours into a shift. Nobody at St. Jude's knew much about her past, only that she had transferred from a VA hospital out west a few years ago. She didn't gossip, she didn't complain, and she never missed a vein. But St. Jude's had a new king, and he demanded absolute worship. Dr. Mason Alpert had arrived 3 months prior, bringing with him a pedigree from Johns Hopkins, a wardrobe of custom-tailored suits he wore under his lab coat, and an ego that barely fit through the double doors of the ambulance bay. He was a brilliant cardiothoracic surgeon, a fact he reminded the staff of at least twice a shift. To Alpert, the hospital was a monarchy. He was the reigning sovereign, the doctors were his court, and the nurses were the peasants' replaceable, uneducated laborers whose only purpose was to hand him instruments and absorb his frustration. The friction between Isabella and Dr. Alpert was immediate and visceral. Alpert hated her silence. He hated that she didn't flinch when he threw a tantrum. Most of all, he hated that she was almost always right. It started on a Tuesday evening in Trauma Bay 3. A 25-year-old cyclist had been clipped by a taxi. Alpert, rushing through the assessment to get to a high society charity dinner, declared the patient stable, diagnosing a simple fractured humerus and a mild concussion. Start him on an IV drip of Dilaudid and prep him for ortho, Alpert had barked, tearing off his gloves. "I'm out for the night." "Doctor," Isabella had said, her voice low and steady. "His respiratory rate is climbing, and I don't like the distension in his upper left quadrant." Alpert stopped, turning slowly, as if he couldn't believe a peasant had spoken out of turn. "Nurse Jenkins, is it? Did you attend medical school?" "No, doctor." "Fascinating. Because I did. I spent 12 years mastering the human body. What did you do? Take a 2-year course at a community college?" He leaned in, his voice dripping with condescension. "The patient is hyperventilating because he's in pain from the broken arm. He's bloated because he probably had a heavy lunch. Give him the meds and stop playing doctor." Alpert stormed out. Isabella didn't give the Dilaudid. Instead, she quietly pulled an ultrasound machine to the bedside. 2 minutes later, she found the ruptured spleen that was slowly bleeding out into the young man's abdomen. She immediately bypassed Alpert, paged the on-call general surgeon, Dr. Eris Thorne, scratch Thorne, Dr. Eris Miller, and rushed the patient to the OR. When Alpert found out the next day, he was livid. He cornered Isabella at the nurse's station, slamming his hand on the counter. "You deliberately undermined my authority, Jenkins." "I saved your patient from bleeding to death in a holding bay," Isabella replied, not even looking up from her charting. "You got lucky," Alpert hissed, his face red. "You overstepped. If you ever go behind my back again, I will have your license revoked. You are here to follow my orders. Nothing more." Isabella finally looked up, her piercing blue eyes locking onto his. There was no fear in them, just a cold, evaluating stillness that made Alpert involuntarily take a half step back. "My job is to advocate for the patient, Dr. Alpert, not your ego." The feud was cemented. From that moment on, Alpert made it his personal mission to break her. He assigned her the worst cases, nitpicked her charts, and berated her loudly in front of the younger nurses. Chloe, a 22-year-old recent nursing grad who practically hero-worshipped Isabella, often retreated to the supply closet to cry after Alpert's tirades. "How do you stand it, Isabella? Chloe asked one night, wiping her eyes after Alpert had yelled at her for handing him the wrong gauge needle. He treats us like we're dirt beneath his shoes. Isabella handed Chloe a tissue, her expression softening. People like Mason Alpert operate on the illusion of control, Chloe. They yell because they are terrified of chaos. You just have to remember that his volume doesn't dictate your value. Do the work. Protect the patient. Chloe sniffled. It's just, he makes me feel so small. He's a civilian, Isabella murmured, almost to herself, her eyes tracking out the window toward the dark Chicago skyline. He thinks the worst thing that can happen in life is looking foolish. What does that mean? Isabella shook her head. Nothing. Come on. Beitu needs a dressing change. Isabella never mentioned her past. She never talked about the dry heat of Kandahar, the deafening roar of incoming artillery, or the smell of burning Humvees. She never talked about the men and women she had held together with combat gauze and sheer willpower in the back of violently shaking Black Hawk helicopters. St. Jude's was chaotic, yes. Alpert was a tyrant, yes. But to Isabella, nobody was shooting at them. The lights were on, the floors were clean. This was easy. But the hospital was about to get a painful lesson in what real high-stakes chaos looked like. It was raining relentlessly on a Friday night when the red emergency phone at the nurse's station lit up. It didn't ring. It blared a harsh electronic shriek reserved only for mass casualties or incoming VIPs. Isabella snatched it up. St. Jude's ER, Jenkins. Code Crimson. ETA 4 minutes. The dispatcher's voice crackled, laced with a rare, breathless panic. Multiple vehicle pileup on the I-90. A semi lost its brakes and plowed into a secure convoy. We have a primary target, 19-year-old male, massive blunt force trauma, crush injuries to the chest and lower extremities. Vitals are crashing. He's hypotensive and tachycardic. Escort is heavy, Jenkins. I repeat, heavy. Understood. We're clearing Bay 1, Isabella said. She slammed the phone down and hit the general alarm. Listen up, she barked, her quiet demeanor instantly vanishing, replaced by the commanding bark of a military veteran. The entire ER froze. Code Crimson, 4 minutes. I want Trauma 1 fully prepped. Chloe, pull the massive transfusion protocol cooler. Get me 2 rapid infusers. Set up for a chest tube and page doctor. Alpert right now. The ER exploded into synchronized motion. Dr. Alpert jogged through the double doors 3 minutes later, annoyed and still chewing on a piece of steak from his dinner in the doctor's lounge. What is this, Jenkins? I was in the middle of multi-trauma incoming secure convoy, Isabella interrupted, tossing him a sterile gown and gloves. 19-year-old male, crushed chest, dropping pressure. Before Alpert could complain, the wail of sirens drowned out the rain. It wasn't just one ambulance. It was an entire fleet. The automatic doors blew open and chaos poured into St. Jude's. Paramedics sprinted alongside the gurney, but they weren't alone. They were flanked by large men in dark tactical gear, soaking wet, their eyes scanning the room with lethal intensity. The Secret Service? Private military? Isabella didn't care. Her eyes were locked on the patient. The boy on the gurney was barely recognizable under the blood. His left leg was mangled, the bone protruding sharply through the denim of his jeans. He was gasping for air, his lips a terrifying shade of blue. Transfer on 3, a paramedic yelled. 1, 2, 3. They hauled the boy onto the trauma bed. Heart rate is 140. BP is 70/40 and dropping, the paramedic reported. We pushed 2 liters of saline, no response. All right, clear out, let the professionals work, Alpert shouted, shoving a tactical agent out of the way. The agent tensed, hand dropping toward his belt, but another agent shook his head. Alpert zeroed in on the gruesome, bleeding leg. He's bleeding out from the femoral. Get me a tourniquet, clamp it. Chloe, push 2 units of O negative, fast. Chloe fumbled with the blood bags, her hands shaking under the intense glare of the tactical team watching their every move. Isabella ignored the leg. Her eyes darted to the monitor, then to the boy's chest. The left side wasn't rising. The veins in his neck were bulging grotesquely against his skin. She grabbed a stethoscope and pressed it to his blood-slicked chest. No breath sounds on the left. Muffled, distant heart tones. Dr. Alpert, Isabella said, her voice cutting through the shouting in the room. The leg isn't killing him. He has a tension pneumothorax. His lung has collapsed and is crushing his heart. He needs a needle decompression right now. Alpert didn't even look up from the leg, struggling to clamp the severed artery. Shut up, Jenkins! I can see the arterial spurts. He's hypovolemic. Push the blood. His pressure is 60/30. It's not hypovolemia. It's obstructive shock. If you push blood without relieving the pressure in his chest, his heart will stop. Isabella stepped closer,